All right. Hey everyone, I hope this actually works. I'm Dr. Alana, and we are doing our first Zoom Live. Hopefully you can see us and hear us. We tested this out a little while ago. It kind of works. So today our guest is Dr. Chad Brandt. He is a clinical psychologist, and he's awesome, great guy, super funny. When I've sent patients to him, they're like, oh, he's so funny. I'm like, I know, he's very funny. Not a lot of psychologists are funny, Dr. Brandt. To be honest.
Well, we'll see.
Right.
Now I have to perform.
Right. There's jokes. There's dad jokes.
There's a lot of dad jokes.
Oh, a lot of dad jokes. We'll get to those later.
Sure.
He is the father of 2, 1 on the way, so that'll be 3. I'll have to tell you later, remind me to tell you about the fact that 3 is a very uneven number and that parents of 4 are the happiest.
Okay,
So
yes. We just got to keep having children.
Just keep going. Just so you know, parents of 4.
I'll tell my wife.
Yeah, maybe tell her a few months after delivery. I don't think telling her right before the delivery.
Not now. Nothing's happening right now.
No, nothing. So we wanted to talk today about how to talk to children with COVID-19, and it was really nice for you to join us and tell us your thoughts because you're a clinical child and adolescent psychologist, and I'm sure you see even maybe patients of all ages. And I know you've dealt a lot with OCD.
Yes.
So that's the obsessive compulsive disorder. So I kind of joked with you before because a lot of your previous clientele probably were germaphobes, and now you're like in the midst of like everyone now is a germaphobe. So either your business is going to skyrocket or all the germaphobes are going to say, see, I told you.
That's right. That's exactly right.
So in some ways they're kind of validated, right? They were doing it right.
Absolutely. It's terrible.
Yeah. So it's a problem, right? It's always a dilemma.
Yes.
Yeah.
You know, it's interesting with OCD. It has been a little bit of a problem because the patients will say, well, you know, this has all been the right thing for me to do, to wash my hands for hours and hours a day, or whatever. And one thing that I'll tell parents of any age kid or with or without OCD is to set your standards, like now, beforehand, in a moment of calm. Versus just letting our anxiety take us wherever it takes us. And I'll recommend the CDC guidelines, safe hand washing.
Right.
Sing yourself happy birthday twice, about 20 seconds. You don't have to get too perfectionistic about it.
Yeah.
And then we can move on. And that might be what's kind of normal right now.
Right.
Versus 10 minutes of washing, an hour of washing, or whatever some people would really like to do.
But it's tough, like even here in my office building, like the public restroom, you go into it and then normally you'd wash your hands and I'd go right out the door and I wouldn't give it a second thought. And now it's like I go to the door and I'm like, I forgot the paper towel to open the door. Okay, I have to go get it. Anyway, I've wasted a lot of paper towels, I guess. I'm not, I need to follow the steps a little bit better. But I think it is a challenge for people who do have OCD. But I think this is also a super challenging time for people who either have anxiety, have depression, or now have new onset anxiety and depression, because there's so many like unknowns, like how long is this going to last? What do I do with these kids? Are they going back to school in the fall? I mean, the questions I keep getting asked as if I'm the expert on whether summer camp's going down. I don't know. But I mean, parents will text me in the middle of the night going, by the way, do you think this is going to end anytime soon? And I'm like, I don't really know. I don't see summer camp in June, maybe even July. I mean, August, I'm not sure. I mean, it might just be a wash. And then they're like, well, do you think our kids will go back to college in the fall? And all I can tell you is I sure hope so. I love my college student. But, you know, we just sent her away to college and now she's back. So that was quick. And so, you know, part of going to college is like, you know, spreading your wings and learning independence. And when suddenly you're now the head shopper for your family's home, you know, it's a big change for them too. And so a lot of the questions, at least I'll hit you up with today, and feel free to throw in things that I've left out, is how to deal with explaining to kids of all these different ages kind of what's going on without adding stress to their life, but maybe in such a way that especially the older kids understand a little bit of the severity of it, so that they're not, especially like the teenagers, the young 20s, aren't running around with all their friends and kind of, you know, explaining. So maybe starting from the super young ages, like what did you tell your really little ones?
Yeah, so for really little kids, so my sons are 2.5 and 4.5, and we'll tell them right now, for instance, that some people are getting sick, and because people are getting sick, we want to stay away from people so that we don't get sick and pass the sickness around. And usually with real young kids, I would recommend giving them kind of one or two real pieces of information and then kind of dropping it and moving on. Kids can only internalize so much to begin with. And if I give them 2 or 3 sentences and say, so, some people are getting sick, we don't want to get sick, so we're going to stay basically in our homes for a few weeks, and then you can go see your friends again, that's usually enough. But if I start really drilling into a 5-year-old what's happening, all they're hearing is like, oh no, this is a really big deal. I should feel really worried. Mom's clearly really worried. Dad's clearly really worried because he's talking to me for 10 minutes about this, so I should worry.
Well, to that end, it's like a lot of parents have Fox News or CNN or the Trump briefing or something in the background at the home all day.
All the time.
Right. I know if I ever go to my in-laws' house, like the only thing they play on the TV is like some sort of news, and I'm like, oh. But the question is that helpful? And is it even helpful for people of all ages, right? I mean, I think there is a little bit of get a little bit of information, digest it, but don't revisit it because...
all day long.
Right.
Yeah. One question I'll ask for kids and adults, I'll ask a lot is, what's the message that you're sending to your brain, right? And is the message that you're sending to your brain right now, oh no, everything about coronavirus is important, and I need to be checking in with the news for 10 minutes every hour, because you're just sending your brain all this message that all this is very, very, very important. And then your brain's going to give you that feedback later and just ask you a lot of questions about coronavirus. What should we avoid? Can I touch this? Can I touch that? What happens a month from now, or 3 months from now, or a year from now? And you're just kind of feeding an anxiety system. The more information you put in, the more your brain will kind of spit out. So for adults, I usually recommend, depends on the person, but usually, like, if you want to check the news, maybe 5 or 10 minutes at the beginning or the end of the day. At this point, we know what's happening. We know the guidelines that are in place. You should stick to them. Watching the death numbers climb up one by one is not going to help. Not going to help you feel any better.
Right.
And it's going to do the opposite.
In our office, we had to give up on that, and we went straight to just reading children's books because we found that seemed like a better use of time, because it was, because I think it's hard, and if we did this even for the flu every year or heart disease or anything else, it's also a bit overwhelming.
It would be.
And it's so I think it's a little bit more than most people can digest, and those of us who are in medicine who are maybe more used to the idea of the circle of life, but for I think everyone else it's really difficult. And then I think that it's been very hard to see all of the reports of the unexpected person who got very sick and died. And when that happens, I think that produces a lot of anxiety too, and that's really difficult. And so of all ages, and in terms of all ages or kids, I will always implement or suggest parents are very honest. So this would maybe be more appropriate for an older child or even a teenager, but to say, some people do die from this, right? And if you do get sick, you are 13 and you're healthy and I'm healthy, and if we were to get sick, chances are really, really, really low that something bad would happen. And if you did get sick, we would go to the doctors and we would make sure it didn't happen. We would make sure to give you the best medical care that we could, or whatever. But this is kind of serious, and that's why we're staying inside. That's why we really can't go see your friends right now. That's why we're taking these precautions. So we're honest, we're real, but we're not kind of beating the point down and saying, well, you could die, another 20-year-old died, and you could be dead tomorrow. It's like, well, you could, but now we're just getting in a big kind of fight and power struggle, and it's usually not very helpful. What about like the teenage population? I feel like the younger kids, telling them a little bit and then kind of dropping it, they still want to have play dates, and so I still really strongly discourage play dates. But as the kids get a little bit older, they also, luckily they have some of their social media tools, like the middle schoolers and up, for example, like they're Zooming their class, so they're seeing their classmates. I know kind of the iPad rules went right out the window because, the problem is we still want them to be social, but now we want them to do it respectfully so that they, obviously don't put other people at risk or themselves at risk. But, how do you talk to them so that they understand, hey, yeah, you can ride your bike and go around the block, but you can't stop at so-and-so's house, And how do you, what's a good way to say that in such a way that you're not beating them over the head with the information, not frightening them, but making the point clear that kind of it's a no-go?
Yeah. I think there's a few things that pretty much everybody would know about the virus at this point. A lot of people have it and don't have symptoms, and some people that have it don't show symptoms for weeks beforehand. So it's true that really anybody can have it.
Right.
So we need to act as if kind of anybody and everybody has it right now. And if we just know that, we're going to act as if all your friends have it, even though they probably don't. And yes, Johnny is a really nice kid. He's a nice guy. He doesn't touch anything, but he could have. We're going to treat everybody as if they could have it. And we take the precautions. We stay the 6 feet apart, or you wear the mask, or you wash your hands.
Right.
Then this will all kind of pass, and it'll pass faster. But if everybody starts going and hanging out with their friends, if we all start passing it around, we're just going to be locked down for even longer.
Right.
So this is not me trying to tell you can't see your friends. Trust me, I want you to go see your friends. This is us all trying to, the public announcements are saying, this is us working together, right? And make sure everybody stays safe. And then hopefully this is over soon enough and you can go back to college or school or whatever.
Yeah. I mean, we found in our family it was a little bit easier because we're both doctors. And so I think our children, at least the ones at home, and the ones gone, but anyway, the ones at home for sure, because they see us come home, they see us change clothes immediately, take showers. They know that we have all that protective, personal equipment, even in our vehicle, so, and because they, are old enough to have seen the news and understand that healthcare workers are at a higher risk, and, they've lost, healthcare workers to this, where normally you kind of didn't sign up and say, I'm going to be an ear, nose, and throat doctor, and that was increasing my risk of dying, because that normally didn't happen, right? And so, I feel like for our kids at least, it's been easier to kind of just say, yeah, we're this is what the plan is, and we're all staying, kind of in our little bubble, because, I wouldn't want to catch it and expose anyone else, whether it's, patient I see, etc. And then I think they're worried if they spread it to us, my husband's
going,
every day he gets older, so
yes.
Right. And so I feel like, and then they know their grandparents are elderly. So I mean, I almost feel like it's easier the older they are, but at the same time, I've had other parents tell me they've struggled with their college age student who still wants to just do whatever, you know what I mean? And so it's kind of interesting, but it's almost like from a parenting perspective, laying rules and having consequences for breaking rules. Does that make sense?
Which is general parenting tip number one.
Right.
You have rules, you have boundaries, and you're adherent to them all the time, no matter what. And our boundaries might have changed during this time, like with iPad rules, for instance.
Yes.
But there are still boundaries, and if you cross them, this is what will happen. It doesn't have to be super punitive. Boundaries aren't about punishing kids a lot of times. It's just about saying this is the box that we are living in right
now.
Young kids and teenagers too, even though they would deny this if they were talking to us right now, but they follow our lead as parents. They're watching what we're doing and they're following our lead. So in our house, when my wife and I are both working remotely, I'm in my father-in-law's office, she's in our office. I go out maybe once a week, maybe the grocery store. Sometimes we have it delivered. Even if we have our groceries delivered, we wipe the groceries down because we have elderly grandparents around as well. And she's pregnant, so on and so forth.
Right.
So we set the standard for them, and we say, hey, we're working at home today, and then we're going to play. We'll take a walk around the neighborhood, but we're not going to go hug your friends if we see them. And if we have something come into the house, we wipe it down. But other than that, we don't talk about it too much.
Right.
These are kind of the family rules that we have. It's easier for us to follow them because they're younger, but this is what we do,
right.
And we just kind of move on with our day. And I would like to imagine if our kids were older, they would kind of see us and fall in line with it. versus if I was still going off to work or coming home and not washing my hands or just running out to a different store every day. You're sending the message there that, oh yeah, this is fine, this is okay,
Right.
I can do it, and that every kid is going to say, well, if Dad can do it, I can do it too.
Right. I mean,
so it's us setting the boundaries.
Yeah, and I think that kids do emulate their parents' behavior a lot, and so it's nurture and nature, right? I mean,
yes.
So even like parents will ask me like in prenatal visits, like, well, what about should I play music for the baby? I'm like, well, it depends on which music you're talking about.
That's right.
Yeah.
That's right. You play whatever you like. You should just play it.
Right. Yeah. It probably just it depends on which music you're talking about. What about for littler kids? And the one thing I will say about kids, I think that the parents of little kids are handling this a little easier than the parents of elementary age students, because it turns out homeschooling is legit.
It's hard.
It's apparently really hard. And at least our youngest is 12, so she's old enough to turn on her Zoom. Matter of fact, she's a master at Zoom now. I mean, they're all gonna be like Zoom experts, but she's a master. She can do anything on that thing, and we have to keep asking her for help. But the little kids, I mean, those poor parents, I mean, they are just exhausted and pulling their hair out because they were used to having time during the day, whether they were at work or doing something else. The kids were at school, and now suddenly they're homeschool teachers and they're not good, and so tempers flare. And I don't know if you have any advice for keeping the peace in the house so that you don't.
Yes, a consistent schedule is one of the best things you can do for elementary school kids, which I know is really hard right now, though I would guess most families are figuring that out by now. It's been a few weeks. Right. Consistent sleep time, consistent wake time. Normally the elementary school kids, in my experience, are having check-ins with their teacher one-on-one. So they're spending like 30 or 60 minutes with the school or the teacher in a day, versus some of the older kids are doing a whole classroom for kind of a whole day. So you've got a little bit of time with your teacher carved out. You've got a little bit of homework time that should be consistent for the kid. A little bit of outside time, a little bit of play time, a little bit of one-on-one parent interaction really goes a long way with kids, especially in elementary school. Just for them to know and have time with you and know that somebody's with them and paying attention to them can reduce some of the attention-seeking explosions that you might have, and I know that that's really hard if my wife and I are both working. We have her parents to help, which is very good, but it would be a lot harder if we didn't have them.
Yeah.
We'd be trading off meetings and all of that.
Right.
So I think any way you can standardize a schedule for the whole family.
Yeah. I mean, I think you're definitely lucky your kids are younger, because Common Core math does not make sense.
Yes.
That went straight out the window.
I'm really happy that we're still working on like single digit addition over here.
I looked at it and was like, it's not going to happen today.
Yeah, that's right.
Taught her a whole new way of math. All right.
Good luck next year.
Yeah, right. I know. I was like, it'll work out. What about signs of anxiety, signs of depression? Like, what are things parents should look for to be flags to say, hey, maybe me or my kid isn't handling this as well as I think they could or should, and when should I seek help?
Yeah, absolutely. So signs of anxiety, irritability, difficulty sleeping, waking in the middle of the night, nightmares, especially if they're younger. Just a general jitteriness, fidgetiness, kind of absent-mindedness. Anxiety will just take some of our brain space away normally. So if you notice your kid kind of zoning out more, having a little more trouble focusing, that could mean that they're anxious about something. Young kids in particular have a really hard time understanding and expressing their feelings. And so anxiety might come out in disruptive behavior. So that might be something you're seeing at a younger age. As they get older, repeated question asking, especially the same question multiple times, can be a sign of anxiety. And we're just having a hard time wrapping our heads around it. And I'm just trying to feel better, so I'm asking the same questions. But sometimes there's nothing we can do to feel better. School is canceled. There is a pandemic. I don't know when I'll go back. And that's just uncomfortable. And some kids will search and try to get their answers. And when they can't have it, that'll be really hard. So one of the things we do in therapy is teach kids to handle, or adults, teach people to handle uncertainty, move forward despite uncertainty. So those would be some symptoms of some signs of depression or anxiety, I mean, in kids and adults. And then for depression, you'd see hypersomnia or insomnia, way too much sleeping, way too little sleeping, just trouble getting moving, trouble getting out of bed, lack of enjoyment of things they normally enjoy, the symptom of depression. The difficult thing right now is the treatment for depression, we would call behavioral activation. It's usually get up and go do stuff, even if you don't feel like it. It's kind of my catch-all depression kind of starting point. And what do you do when you can't get up and get out and go do the stuff you normally enjoy? Right. So I'm working with a number of clients on, for adults, maybe some kind of continuing education course, some kind of online course, something kind of meaningful to them. If they've been furloughed from work or something, they can put their energy towards their career in a meaningful way. Getting up, talking to family or friends on the phone or video chats, taking walks, getting some exercise at a socially appropriate distance would be some of the things for adults. And it's much the same for kids. How can I schedule in some time with friends, maybe via Zoom or something? How can I get them outside, even if they don't want to be? Those would be some of the treatment starting points for depression. And some of the treatment starting points for anxiety would usually be the same. Can we do something even though we're uncomfortable? Yes, coronavirus is scary, but maybe we can still go on a family walk. Even though we're scared, maybe we can go outside for a little bit. A lot of kids afraid to go outside, and adults right now. I'm just kind of pushing the boundaries of your anxiety, showing your anxiety that you can be anxious and do something anyway. It's a good starting point for that.
It's interesting. I think there's probably some families who are afraid to go outside. And then I think there's, like, if you go through Westview or, like, the Heights, I have never seen more people out in those areas. And even I feel like they're doing a good job of socially spacing out. Although parents will tell you you're not wearing helmets, and that really is, like, driving me. Kids emulate behaviors once again. And so if you're going to ride a bike, especially if you haven't ridden, you need to wear a helmet. I guess that's my point. The one thing we've seen is illness plummeted because it turns out going to school is a global health crisis.
Yeah, that's about right.
Because suddenly kids aren't getting strep all the time and the flu just went away. And so we're getting very few calls for, he has a fever and he's sick, because people are actually socially distanced. So we know that part's working for all illnesses, I would say, at least infectious disease. But we've seen more kids need sutures, stitches, staples. They're hurting themselves, breaking bones. And so, it's almost like it's summertime in a way. But because you're kind of isolated, parents are like getting things like a bouncy house and a trampoline, or things that might be a little bit, more risky. And so from some standpoints, I feel like I've seen more of the opposite, where we've seen more people out and about than maybe we ever really noticed before. And so do you think there's maybe some positives that come from the whole, like, what's the best positive? Because I feel like we talk about the negative so much, but I feel like there's a lot of positives that have come from the pandemic, and we will not discuss the oil prices.
Absolutely. Absolutely. I think from a mental health perspective, for people to have time away from work, especially if you have time doing your work differently and still getting paid, to be able, so for me, for instance, I gained an hour and change a day in my commute, because I'm doing all of my therapy. I don't do in-person therapy right now. So I have an hour of my day back. So I'm getting a little bit more sleep. I'm getting to do breakfast with the boys that I normally don't get to do. That's really meaningful time for us, I'm finding, albeit frustrating sometimes. There's some benefits in the time we're getting to spend with our family that we normally don't get. The time we're getting to spend outside. This is the time we should all be outside. Summer in Houston is not the time that we should be running outside. So to be outside appreciating nature a little bit is fantastic. I think people are getting more exercise as they're able to. So I think there really are some benefits. And I'll be really, really curious how this changes when we all go back to normal, whatever that's going to mean and whatever that's going to happen. How our jobs change. Because for me as an OCD therapist, there's a lot of my patients, primary OCD therapist, a lot of patients who have their triggers are in their house. It might be toilets or whatever it is in their house that they're afraid of. And for me to leave my office and drive to their house and do the therapy and drive back, that's basically that costs a lot of money. most people can't do it. But now we're just doing it on Zoom, and the toilet's right there, and we can do what we need to do way more easily.
Right.
So I'll be very curious how it changes, my job, your job,
right.
A lot of people's jobs.
Yeah, I mean, we were already heavy users of things like telemedicine and a HIPAA secure texting platform. So we found for our patients there wasn't a huge change. I mean, the biggest change was we see sick patients on the roof of the parking garage wearing all sorts of things that we didn't wear, and it's really hot. Like yesterday was super hot. We were a little bit miserable actually.
Garage especially, it's getting there.
We're like, we might have to find a shady spot. But so from that aspect, like things, changed a bit. But at least when it comes to like us being able to take care of patients, that part really hasn't changed. And I think from that aspect, you're right. A lot of businesses and different are realizing, why do we constantly have people travel international when it turns out the Zoom thing is pretty efficient and a lot less expensive than traveling, flying to Germany for that, conference, etc.
Absolutely.
So I mean, those would be positives. I mean, the negatives to that, to me, are there's just less in-person interaction. But I feel like during a pandemic, people are so nervous to have in-person interaction that that's okay.
I think it's okay for now. It'll be curious how we all pick that back up in time too, because we're social animals. It is very, very important.
Right.
I don't know. We'll see.
I mean, it'll take time for it to all, I guess, come out in the wash to see how, to see, does mental health go up? Do we end up having a mental health crisis? And maybe that will also be from just the economy, the unknown, so that you'll have more of that. Or are we going to have more true germaphobes?
Yes, that's coming. I can tell you right now that one's coming.
You're going to be a busy man, Dr. Brandt.
A big part of my job is helping people deal with uncertainty. How do we have uncertainty in our lives and move forward? We all have uncertainty right now. But I think it's important that the how we deal with uncertainty is more important than the fact that we have it. And how am I able to recognize that I'm feeling anxious or uncomfortable and still go to work, still take control of my life in the way that I need to or want to, instead of being crippled by it.
Right.
Which happens so many times. So I would be curious.
I mean, it really is the life gives you lemons lemonade, I mean, so the people who will thrive, I think, will be the people who adapt. Whether it's businesses that adapt, people who adapt, who instead of crawling into a shell and just, So I liked the idea of picking a new hobby. That hobby does not have to be only watching Tiger King on Netflix.
Nope.
But if you haven't... At least it was interesting.
I still haven't.
Well, the good news is now they have Michael Jordan, The Last Dance. It's fantastic.
Yes.
So, I mean...
so many things.
Oh, so many things. So, I mean, I don't know if Tiger King was a good thing to come out of this, but there are, I think, some good things. And for us, we're eating together as the family almost all the time. We cook more at home than we ever cooked before. Now the kids want to go ride bikes as a group. They're content to sit, on our driveway in lawn chairs, just to be outside and chat. I mean, so, we did buy the table tennis that goes on your dining table. I was too cheap to get a ping pong table, but, So who needs to eat dinner there? That's where we play ping pong.
Yeah, exactly.
Yeah. I mean, so I think for us, we immediately, when this happened, ramped up our home gym and looked for ways to have more interesting things to do at home, whether that's getting puzzles. But I do think most people I've talked to feel like they've spent more time with their family over the last month than they've probably ever spent before. And a lot of other countries are like that, like Norway, where, that's a normal way of life. Like it's frowned upon if you would stay at work past 5 because you're supposed to be home with your family. And so, if some of those things get adopted here, maybe that's not such a bad thing. As long as we maintain the economy.
Yeah, absolutely. I think there will be some nice things that come out of this for families. And to use this time too and appreciate it a little bit as much as we can, I think is helpful.
What about any advice for making sure, because I feel like some of the anxiety that kids have, I notice this with parents who have a divorce or parents who go through like big life changes, is sometimes their kids' anxiety is, we see it a lot as stomach aches, like suddenly my tummy hurts all the time, but is parents who are talking about finances. right?
Mm-hmm.
Or are suddenly worried about this or that. I mean, so do you normally recommend, do you ever see, at least in your practice, that sometimes the anxiety you're seeing in a child, a lot of it is manifesting because of problems going on at the home, and so the child's just feeding off the parent, if that makes sense?
Yeah. Oh, absolutely, absolutely. And the kids are going to pick up on what's important. So, like we were saying earlier, if you have news on 10 hours a day, you're sending that message to the kid all day long that this is important.
Mm-hmm.
This is really important. We need to pay attention to this all day long. And then the kid's going to pay attention to it and feel nervous.
Mm-hmm.
So at home, if we're talking about finances, which is a real concern
Mm-hmm.
for people right now, whatever we're talking about, they're going to pick up on.
Mm-hmm.
And so sometimes I think it depends on the age of the kid if we think about something like finances. But an older kid, you might be able to say, this is what's happening with my job right now, or this is
Mm-hmm.
this is what this might mean, to give them some honest feedback.
Right.
I've been furloughed for a month, so for a month we kind of can't spend as much money, but then I'll have my job back and it should be okay after that.
Mm-hmm.
I think to give them that one piece of honesty and maybe a little bit of a plan too.
Mm-hmm.
So say you've been furloughed for a month, so we're honest with the kid about what that means in age appropriate language, and we say, so our plan for the month is this. Here's what we're going to eat. Here's what we're not going to buy. Here's
Mm-hmm.
what we still can do.
Right.
And then you enact a plan. It gives the kid a little bit of a sense of control.
Okay.
We're all playing together. We're all eating peanut butter jelly sandwiches for lunch or whatever. Maybe that's what you always ate anyway, but now it's part of our plan.
Right.
To make sure everybody's okay.
Mm-hmm.
And then normally, if they feel like they're part of it and they're helping in even a small way, that will be very helpful.
Mm-hmm.
But when we just kind of worry out loud about finances a lot and
Mm-hmm.
don't say anything about what we're doing and don't let the kids know,
Mm-hmm.
hey, here's a plan in place, here's what you can do to help, or you ain't do anything to help, here's what I'm doing to help right now.
Mm-hmm.
Then they would start to worry. And then they're
have you had any patients yet who had anxiety or fear because maybe a grandparent or even a parent or someone actually got sick with the illness?
Yes, it has happened and will continue to happen. And I, for something like that, I think we'd go back to honesty.
Mm-hmm.
Grandma got the coronavirus, and right now she's with the best doctors that we have,
Mm-hmm.
and we're really going to hope that she's okay and they're doing everything.
Mm-hmm.
And then and I would usually aim to kind of keep the conversation short, and then the kid would naturally have some questions. What if grandma dies? I guess if we go really hardcore about it,
Mm-hmm.
and you can say, depending on the age of the kid, but you say, that I guess that might happen. We're really going to do our best for grandma. I really don't think it will. And what would really help grandma if you drew her a picture?
Mm-hmm.
What would really help grandma if you made her a recording and somebody could take it to her and she could hear your voice.
Mm-hmm.
Kind of an older kid. So you're giving them a little bit of a sense of control.
Mm-hmm.
Here's what you can do to help. Then you help them do it and drop it.
I think this was always difficult because even say we were 4 months before we all got stuck in Zoom,
Mm-hmm.
and this was 4 months ago, and grandma got very sick and was at the hospital, and then you had to decide, do I take my young child to visit grandma or not? Now that's completely off the table because there's really no visitors, right? And so FaceTime, but if grandma's on a ventilator, you know what I mean? Like, do parents and I'm sure you've thought of these scenarios too, is what advice do I give people if the loved one's actually really, really sick? And what age is appropriate to let them, say, FaceTime someone who is really sick, or even visit them in the hospital if we were 4 months ago? You know what I mean?
Mm-hmm.
So what about that? Because that causes, I think, a ton of anxiety.
Yeah, and I think this is a kind of a case-by-case basis. If someone is really sick and we're able to visit them or even FaceTime them. At a young age, it's really hard to conceptualize something like that.
Right.
Even before like adolescence, it's very hard and it can be really, really scary.
Mm-hmm.
And so we give the kid a little sense of control. Grandma's very sick. She kind of can't talk right now, but you can do this. You can draw a picture, let's just say. Might be helpful. For a kid, I would give them the option.
Mm-hmm.
A teenager, I would say, here's what's going on with grandma. We don't know what's going to happen. You can talk to her or not. I totally up to you. I don't want you to feel pressure in either way, but I do want to let you know that you have the option. And then give the kid or the teenager, young adult, some space. You don't have to decide now. but you can. If you don't want to, that's going to be just fine. If you do want to, that's going to be just fine too. We'll help you. So you give them, again, a little sense of control.
Yeah, I mean, because the one thing that's important is even though they might not have COVID, just as many people are going to have attacks, be diagnosed with cancer, and even in the pediatric realm, the one thing that'll go down is other types of infectious disease because we're spaced out. But just as many kids are going to be diagnosed with cancer this year as was last year.
Yes.
And,
yes.
So we always relied a lot on child life, pastoral care, all of these things. And, but normally the family would be there to support that child. And now with the rules changing so much, I mean, even with having babies in New York for a while, I mean, they weren't having birth partners, which, was probably also very difficult and, devastating. But at the same time, they were in kind of the midst of a major problem. And it was hard because there's, I think, so many unknowns. And the one example I've given, the kids, and although zombies are not the best word to describe it, it's, but you've kind of heard that where you said we thought that it'd be easier to tell who the zombies were. Like, you'd be able to easier to tell. And like with things like Ebola, it was kind of obvious if someone got Ebola. So it was easier to like suddenly prepare. Whereas with this, it's been such an unknown. And then with things like cancer and other stuff, it just happens. And it's still going to happen. And, so one of the things that I've been asked is, well, how long does this go on? How far do we have to get before we're like going back into the hospital to help take care of grandma who got cancer? Yeah. And I was like, I don't know. And that's why I think almost having a plan in place now to think about these things, kind of like advanced directives, is a good idea instead of waiting till you're in the throes of the moment and now you're in a high stress situation and someone in your family is very sick. What do you do?
I'm a big fan of a plan before we're anxious. In the middle of the big anxiety moments, it's very hard to come up with a rational plan. But yes, right now to say, okay, grandpa's in the hospital and we're going to get him an iPad. Somebody's going to get in there and give him one. And then here's our schedule to call grandpa. Somebody's talking to him every day or something, right? Gives everybody a sense of control, gives grandpa something to look forward to, lets the kids know that we're making a plan. It shows them good problem solving skills, that we can be anxious and upset and still get something done. And that's very helpful versus what anxiety would want us to do is just kind of sit in one place and spin our wheels. I don't have a plan. I'm panicking and I'm calling dad or grandpa or whoever multiple times a day, just depending on how anxious I am, and the kid's going to see that.
Right. Right. So
just showing them this is how we do it. This is our plan.
Right. So maybe even having a plan before you need a plan.
Yes. It would be great. And nobody probably had a plan for a pandemic before it happened, but now maybe we will.
Right. But now you've had a little foresight. So now, and in fairness, we had a little bit of foresight with what was going on in Europe. So, I think that in our family, we thought about things like that is if this came and happened here the way it did in Italy, and they have to ration ventilators, that is a conversation to have, that was a very difficult situation. And we're very fortunate that has not happened here, at least in our community at all.
And knock on wood.
We flattened the curve pretty well.
Yeah. Seem to do pretty darn well.
Well, when people ask me, I'm like, we're a very large city. We have one of the best medical centers in the world. We have the largest medical center in the world. We have a good number of beds, obviously, but we also don't really have mass transportation. And there's only one flight direct that I know of on Air France from Paris to Houston. Everyone just stops through Newark, and they stop through New York. When it comes to international travel, it's just because we're in the middle of the country, so many times it stops there before it heads here. So in some ways we're a little bit more protected, but then again, like I said, we drive cars. There's cities where they didn't have as much in the way of people being able to separate themselves because they have a vehicle, because that's a pretty good social isolating tool. It has a cover
for worse most of the time and better during a pandemic.
Yes. Right, like no one would be spreading it, even if 610 was packed right now. As long as you're in your car with the windows rolled up, you're probably pretty safe.
Yeah, absolutely.
Yeah, I mean, if they came out later and say, "Oh no, it turns out," and we're like, "Oh yeah, we're in trouble," but that clearly must not be the case because from that aspect. So I think mass transportation was probably the, and we closed the rodeo.
Yeah, what a good decision in hindsight. I was so disappointed.
I
'Cause
was
the boys
not.
love the rodeo. So disappointed. But obviously now in hindsight, that was the right decision. I had a conference that I was supposed to go to the weekend before that as well that got canceled, and I was so disappointed.
I was supposed to
And
run the
again,
Boston.
obviously.
I was supposed to run the Boston Marathon on Monday.
Oh, really?
I was not disappointed, and I had foresight and stopped training like 6 weeks ago at least. I was like, yeah, that's not happening. So
No.
I just started jogging again, and so
Yeah, good for you.
yeah. But my poor friends who didn't have that foresight, they've been running like crazy, and then they were disappointed. I was like, oh yeah, no, the Northeast, you just knew it was not going to happen. All right, well, I think that was super helpful. So we definitely know to look for anxiety for the kids. Depression, especially the sleeping too much or suddenly napping during the day when they didn't before. Because I think it is hard, especially the young, like my 12-year-old's age. I still think this is hard because she's just, the Indians are getting restless. They want to be with their friends and, you know.
Yeah.
I mean, we've learned TikTok, so, I mean, you can learn too. And then, the OCD, I think you're right. I think the germaphobe rate will go up a bit, but maybe not such in a bad way if it's not obsessive. But at least, as long as it's not an obsession, but, people
Then
learning to wash their
that should
hands
be-
is a good thing.
Absolutely. So, yes, I thank you for talking with me. It was a pleasure to
Yeah.
come and talk about psychology for a while.
I know. Flu season done. All right.
That's right.
Thanks very much. And then we put a link on our Facebook page to your page because you had a page that on your regular website that had a lot of helpful tips for talking to kids with COVID about COVID-19.
Yes.
And so a lot of it had some, the be honest and, and I think said guidelines, be patient. All those things are, good things to follow. So thank you for joining us.
Absolutely.
We'll chat again under different circumstances, I'm sure.
Maybe in person one day.
Yeah, I know. Carry on with your working with the toilet through Zoom. That's pretty...
Oh, it's great. I don't have to touch them anymore.
I know.
I don't really care anymore, but it's nice to not have to touch as many toilets.
Yeah, I mean, people don't know this, but I've known Dr. Brandt for a while, and that was one of the things you used to tell me was every day, your hand went in a toilet, your hand went in a toilet.
Oh, every day.
And I was like, oh, no. But then I met someone who's a severe germaphobe, and I offered to take her to the bathroom to put my hand with her in the toilet, and she was absolutely no. And I was like, oh, well. So I didn't think I could do your job. I couldn't convince her at all, actually.
It took 800 years of schooling to convince somebody to put their hand in the toilet. That's basically what I have.
And now I won't, if something falls on the floor, I'm not eating that. It's like, it's gone. Straight to the trash. I mean, yeah, so it's a balance. The germaphobe thing's a balance, so.
It is. We'll figure out our new normal soon enough, hopefully.
Yes, well, we'll touch base when we figure out what that is.
That sounds good.
All right, well, air high fives for now.
That's right.
All right, okay, thanks. I'll talk to you
Thank
later.
you.
All right, bye. I'm going to try to push this button.